Welcome, dear viewers of Mana TV International. We are back again with yet another discussion about AAPI, American Association of Physicians of Indian Origin. And today we're going to talk about the Global Healthcare Summit 2023 to be held in Visakhapatnam, Andhra Pradesh, India. When, how, and what will be the agenda will be discussed with the president of AAPI, Dr. Ravi Kohli. And before that, let me dive into a little detail about AAPI. American Association of Physicians of Indian Origin (AAPI) represents the values and interests of more than 80,000 practicing physicians in the United States. In addition, it also serves as a platform for more than 40,000 medical students, residents, and fellows of Indian origin in this country. The AAPI YPS MSRF Young Physicians Section, Medical Students, Residents, and Fellows Section is a vital and integral part of AAPI, and their participation and contributions in the AAPI leadership and field of medicine is highly valued. And now, let me introduce you to our guest of honor, Dr. Ravi Kohli, who is the president of AAPI, American Association of Physicians of Indian Origin. A little bit more detail. Dr. Ravi Kohli has a dynamic and diverse team comprising of Dr. Anjana Samadar, President-elect Dr. Satish Katula, Vice President Dr. Meherbala Madhavaram, Secretary Dr. Sumul N. Raval, Treasurer Dr. V. Ranga, Chair, Board of Trustees, Dr. Pooja Kinkhabhavla, President of Young Physicians Section, and Dr. Ammu Sushila, President of Medical Student, Residents, and Fellows Section, and Dr. Anupama Gottimukula will continue to guide AAPI as the immediate past president of AAPI. And now, let me introduce you to Dr. Ravi Kohli. Dr. Ravi Kohli, the president of AAPI, is a board-certified psychiatrist with additional qualifications in addiction, geriatric, and forensic psychiatry, and serves as psychiatric medical director of Southwestern Pennsylvania Human Services, a former clinical assistant professor of psychiatry, University of Pittsburgh and West Virginia University. Dr. Kohli had served as a vice president of AAPI 2020 to 2021 and secretary of AAPI 2019 to 2020, regional director of AAPI 2017 to 2018, past president of Pittsburgh chapter of AAPI called TAPI, past president of Rangaraya Medical College Alumni of North America, and as the past president of Association of Telugu Medical Graduates in USA. As we know, his tenure has been wonderful and very much lightened up. I'm just reading verbatim his accomplishments so far. There are a lot of them, but I'm just spotlighting some of the webinars he have conducted on investment and tax planning strategies during market decline in October, lifestyle medicine and wellness CME, and he has done a webinar on South Asian heart disease, current concepts in better prediction, detection, and prevention of heart attack in South Asians, and a lot more. He have shown wonderful leadership in his tenure for AAPI as a president. So let me take the privilege and honor to introduce our esteemed guest, Dr. Ravi Kohli, who is the president of AAPI. Dr. Ravi, how are you doing today? Welcome to our show today.
I'm doing great, Sharath. Thank you for having me here. And I want to thank Mana TV International management and the audience for having me here with you and talk about my dear organization, AAPI, American Association of Physicians of Indian Origin. Like you mentioned, it represents the values, the high values of 100,000+ physicians of Indian origin. I'm here to explain anything that you need to explain for me about AAPI and our current and future activities and goals and visions.
Absolutely. I was reading about AAPI. I just told about AAPI to our Mana TV International audience. In your words, as a president of AAPI now, how are you feeling? How is it going? How are the pressures and challenges? And what's the learning? And tell us a bit about AAPI in your words, please.
It has been a tremendous last 5-6 months of my presidency since June 25th, when I took over at San Antonio Convention as the 41st president of AAPI. And I enjoyed every moment of it. And we have a tremendous team, like you mentioned. Every one of them is a great human being, as well as a great dedicated soldier of AAPI. They always work with me very cohesively. And the past leaders have helped me guiding us on the right and wrong ways to do things and not make the same mistake that they have made or future our well laid plans are well executed. And we have done many things over the last 6 months. We have done many seminars and webinars. We have done a Canadian Rockies CME tour. 60 of us went and enjoyed it and learned a lot during our trip as well. And we have done webinars including cardiac health, mental health, physician burnout, physician suicide, financial webinars, as well as recently cancer detection webinars, as well as lifestyle medicine. So we are doing a well-rounded presentation and topics for our members. And also we are serving our communities as well. Currently, we're in the process of unrolling our Share the Warmth, Share the Blanket program for 2022-23. We are covering at least 30 chapters and locations, giving at least 100 to 200 blankets to the needy and the homeless people in cold weather. So Dr. Raghu Lolabatu is spearheading that movement, and we have many chapters from all over the country joining with us, and we're supporting them, and we're delivering the much needed warmth and cheer to our less fortunate people in the streets. And next thing we're planning to do is Global Health Summit in Visakhapatnam. Our Indian counterparts are doing a great job. Dr. Raviraj Garu and Dr. Radha Madam and the team there has put in tremendous effort. And we are conducting our Global Health Summit from January 6th to 8th at Novotel, Varun on the beachfront, best location, most scenic, and one of the resort type of location. So we're looking forward to at least 100 American delegates to come there and join 250 to 300 local delegates and medical students and postgraduate students to come and interact and learn and socialize, as well as learn from our experiences, the ground realities of what needs to be done, how it can be done better.
Wonderful. I mean, sounds like a wonderful plan, and I can see the gleam in your eyes. I've seen your tenure, all the things you have done. We have discussed just now, in glimpses. I mean, the beautiful things. You've covered all the well-rounded topics from mental health, cardiac health, and whatnot. And definitely, I mean, my heart skips a beat and feels happy and emotional when you said that you are distributing, the blankets for the needy in India and various places, which is very important. That kind of struck a chord in me. And as I'm God bless AAPI and many more years of glory and prosperity. So wonderful. We started on a very wonderful note, and you as well spoke about the Global Healthcare Summit in 2023 in January. We'll go into further details, but give our Money TV International a little history of the Global Healthcare Summit.
We're doing the 16th Global Healthcare Summit, and we do it every year around this time with the local team, and we choose a location that hasn't been chosen before, or that is very convenient for the local team as well as the stateside team to work together. So Visakhapatnam is never been there. Actually, this is the first time at Andhra Pradesh state. We have in a combined state, we have done many times in Hyderabad, but as a separate state, Andhra, this is the first time we're doing it. One reason is it has never been done in that part of the country, and there is tremendous enthusiasm from the local team to do it, and there is a tremendous support from them. So we wanted to do it, and also I went to medical school in that area, so that also helps me to do the organizational activity very easily there. So our team has done a great job there, like I mentioned earlier, and we have our main focus is. Actually, the theme I wrote and logo I designed for that is true and total health means mind, body, and spirit wellness. So true and total health is the wellness of mind, body, and spirit. So we're addressing the mental health, including suicide prevention, mental health stigma, and prevention of consequences of mental health lack of treatment. We're encouraging people to seek help. And we're also focusing on the body aspect of neonatal and infant mortality, maternal health. We're also talking about oncology, cardiology, as well as gastroenterology topics, neurology topics. So we're covering a whole spectrum of topics. We're also engaging with the community, local communities. We're also advocating for equity and quality healthcare across the board. And so we are also doing HPV vaccination to at least 100 teenage girls who will be saved from cancer of the cervix, which is fatal in many cases. And this vaccination will prevent at least 90% of those cases from developing. So we're doing preventive care, we're doing advocacy, we're education, we are doing continuing medical education, we're doing research symposium, and we're also interacting with the medical students and postgraduates all over the country who are coming to visit us and stay with us and talk to us and interact with us. We're conducting a medical jeopardy competition we're already conducting preliminary rounds, and 350 teams are participating now. We have research poster presentation coming up. 500 research posters have been presented. We'll have the finals at the Global Health Summit, and we'll give prizes away to the winners. So we're looking forward to meeting our younger fraternity members and guide them and learn from them, as well as teach them the soft skills as well as the core skills that they need to be inculcated to get better and better.
Wonderful, wonderful. Again, sounds like a lovely plan, Dr. Ravi. I mean, when you spoke about the mind, body, and spirit, and you're addressing all those three areas, I mean, looks like you guys are giving a holistic shot toward health and integrating conventional medicine as well. Though I am as well a layman in the subject, I've been reading articles here and there. So at least I know the terminologies, and the terminologies you have used are heartwarming about oncology and different subjects, cardiology, and as you use the word well-rounded, you are a well-rounded person yourself, and the plan is well-rounded too. I mean, excitement is growing now. I mean, I know very much all the Mana TV international audience, different audiences who want to come there, watch. I know you're going to provide them with any links, or we will furnish with further details in the interview and going forward as well. As Mana TV International has always been supporting AAPI, and AAPI has been supporting us, Mana TV International, as well. So, because we have touched on the subjects of different pathologies of SORDS, but this summit is happening in India. Just to recap, can you give us some past initiatives of AAPI in India, so that we can dig deeper into the GHS in India as well?
Right. Over the years, Indian Global Healthcare Summits have produced many guidelines for Indian treatment guidelines. For example, traumatic brain injury guidelines have been written by our team as well as local teams put together, and we published it at our own cost and distributed to many people. And when I went to Visakhapatnam last August, there was a conference going on, and actually one of the vendors were distributing our booklet there. So that was very gratifying to see that. And then we have also helped write guidelines for hepatitis C treatment and hepatitis B treatment, as well as CPR training for laymen as well as first responders. And we have also talked about road accidents, how to prevent them, and encouraging wearing helmets, seat belts, and all those things. We also were tremendously involved all over the country about TB elimination program, how to detect TB and implement treatments on an ongoing basis. We also are now into HPV vaccination. More recently, we're also talking about snake bites and how to protect victims from snake bites. India has the highest level of snake bite deaths. Over the last 20 years, 1 million people died of snake bite. About 60% of the snake bite deaths happen in India. So we're focusing on that. We're also focusing on pediatric cardiac health, and at least 200,000 pediatric infants need cardiac treatment at the birth due to congenital heart disease. Only 50,000 people are getting treatment, and they're not surviving, only 5% surviving. So it's very challenging, but we need to focus and highlight these areas of need, and bring resources together and motivate and encourage people to work on these issues.
Great to know, Dr. Ravi. To progress forward to the next question, tell us why GHS is being held, especially in Visakhapatnam this year.
It's a very good question. Actually, we had some interaction with Andhra Pradesh state government. And last August, when I went there, we met with the Chief Minister, Dr. Jagannath Reddy Garu, and his team. And they encouraged us to take up the challenge of addressing the mental health of the high school students. So we coined a program called APEs, Andhra Pradesh Emotional Assessment of Students by Educators. We are designing it. Dr. Aparna Bhupalas, child psychiatrist from Huntsville, Alabama, is working with at least hundreds of psychiatrists from India on how to educate the medical students, first-year medical students, as well as all the high school students in the state, and the counseling and teachers to be counselors, first line of counselors, and how to triage them, how to take them to the next level of care if they need more clinical care. So we are designing this program. We're trying to look for the funding sources, and we may be able to unroll this program across the state, addressing the mental health of the students and high school students, because if we catch the mental health issues when early in adolescent, they can have better education and better outcomes from their education, better occupational training, and better economic standing in the society. And as a consequence, our economy will improve. So taking care of mental health along with the physical health is very, very important, especially for the children and adolescents, because they don't have as many physical illnesses as elderly and older population, but their mental health is so important. We need to protect it, preserve it, and promote it. So they are the foundation of our next future generation, and they can take our country to the highest level of its growth and potential. So that's what our goal is. Design this program, launch this program. We're hoping our Chief Minister Garu will come and launch the program. We're invited them. We are looking forward to meeting them again and invite them again in the next week when I'm going back to India in preparation of the Global Health Summit.
Wonderful, wonderful. And, I wish you all the best for that. But we're not going anywhere because we have a lot of other questions as well boiling inside. I'm, listening to you, I'm seeing a very well-built plan laid out. Wonderfully chalked out with great scrutiny and meticulousness. Definitely I'm not aware of a lot of terminologies, but the preponderance of this discussion, is growing because of the kind of emotion you're putting into the content in this show as well. That shows how much of hard work might have gone into the Global Health Summit 2023. So wanted to know, before I ask my next question, I have one question which just crossed my mind. What is, you just told about mental health and a couple of other things for children and possibly adults as well, physical and mental health. In totality, what are you expecting? What will be the tangible outcome for Global Health Summit 2023 altogether?
The tangible outcomes are, we want to prepare some guidelines and game plans for mental health treatment rollout for community level care and school level care, so that we prevent the complications of untreated mental health, the symptoms before they become illnesses. So that's one thing we want to accomplish. Then we also want to continue our program of HPV vaccination and promote the program, because we're doing for 100 people is not enough, but every organization in India takes up this challenge and promotes this program. It will save many lives and also saves many costs for the society as well as the government, because at the end it's the government that takes care of the patients, and it will cost them a lot of money as well. So we are looking for some tangible programs of mental health related, cancer prevention, education, lifestyle modification, and preventive care, and promoting all kinds of lifestyle changes, and also not feel stigmatized by having a mental health problem, because stigma leads to avoidance of treatment and then even ultimately can lead to suicide. So these are tragic outcomes. So we want to shed light on the mental health aspect of the well-being. Like you said, holistically, we have to treat. We have advanced care for a lot of physical ailments. but we still are lacking or struggling to accept the mental health as the important aspect of our well-being. So we need to focus on that, bring people to the table and make them comfortable seeking help. Just like they seek help for physical health, they should not have any hesitancy or shyness or modesty about taking care of their mental health. We applaud people who take care of their physical health. They go to gym, we applaud them. They go to their doctor for their checkup, we praise them. They go to their dentist for checkup or eye checkup, we praise them. Same way, if they have an issue, or even if they don't have an issue for mental health, they should have the courage and the encouragement to seek help if there's a need for seeking help. So we want to make it a normalized process, seeking help for mental health issues.
Wonderful, wonderful. I mean, what a noble cause, what a noble initiative, Dr. Ravi. I've been reading about mental health crisis growing in the current years, with as the times are tumultuous as well, maybe the aftermath of pandemic or so many other things, with growing data and the technologies and things. I think there is a toll on the mind of a lot of people, especially children too. So a great initiative by you. I mean, I may be digressing a bit before I step into the other question. Give our Manativ International audience little, if you can stir them up a bit about mental health.
Right. Mental health is the fundamental part of this holistic health. For example, if your mental health is not up to par, your outcomes for even your physical health problems are bad. For example, if you have a heart attack, your survival from heart attack is lower if you have depression on top of it. Only almost 3 to 5 times higher rate of mortality, meaning death from heart attack, happens if you're depressed also. And also, same way, even cancer outcomes are poorer if you have mental health problems on top of it. And unfortunately, people with mental health problems like schizophrenia and bipolar disorder die at least 10 to 25 years earlier than their counterparts who don't have mental health problems. So mental health affects physical outcome, and physical illnesses cause mental health problems. The outcomes are bad when you have mental health trouble on top of the psychiatric medical problem. So we need to address both of them. If you just treat the heart disease, but if you don't treat the underlying medical psychiatric problem, if they don't follow up with the treatment, they continue to smoke, they continue to not exercise, and drink alcohol, use substances, you're counterproductive. So without addressing their mental health, without addressing their emotional well-being, without addressing their social determinant factors, we cannot take care of the physical problems. That is well proven. Data shows that, and we need to address holistically the whole person for even the physical illness to be improved from our treatment. Otherwise, we can keep on spending more money, doing more procedures, repeating the same procedure on the same patient multiple times with poor outcomes because they're not able to crack the code of taking care of the mental health as the first and foremost step in taking care of the physical health. So that's what we want to stress on this during this summit. So don't hesitate. It is very important for your physical well-being to be able to be mentally well and follow the regimen, take care of yourself, and be strong-minded and strong-bodied person.
So you're saying that if suppose I have mental health issues, or if I suspect, and if I approach the proper person, or the proper clinic, or wherever it will be addressed,
Absolutely.
definitely. So that means that I can, a pat on my back saying that, hey, I had the courage to actually take the initiative.
Right. We want to validate people who have the courage. We want to destigmatize people who have problems, should not hesitate to seek help. There's no need to be ashamed or hide it. And you are doing yourself and the society a service by taking care of your problems. And you'll be productive, your family will be happier because it doesn't affect one person. The whole family as a unit will be affected. The whole community they live in can be affected too, because we all won together at the end. So our well-being reflects into the entire community's well-being. So, like I said, taking care of your body is important, but taking care of mind is as important, if not even more important. So it's the fundamental foundation for well-being. So we need to address that. And there is kind of in the media, in our society, in our culture, sometimes we stigmatize mental health, we stereotype mental health patients, even we stereotype mental health providers. So we need to avoid that. We need to change our vocabulary, our culture, our acceptance and acceptance of these problems as normal. And where you have headaches, you have body aches, you have arthritis, you have asthma, that like that. You can have anxiety, you can have depression, you can have some weakness of some kind that can lead to substance abuse or those kind of things. We need to address them because by denying them or ignoring them, they're not going to go away. They're only going to complicate the entire well-being.
True, true, true. Now, as proactive, we all have to be regarding mental health and health as such. And I'm very sure AAPI is being very proactive in their GHS Global Health Summit as well. So I'm digging into this question. Tell our Mana TV international audience, who are the organizers of this summit?
Right. Locally, in Visakhapatnam, Dr. Ravi Raj Garu, the Vice Chancellor of Apollo University, is in charge as the chair of AAPI Global Health Summit India. And Dr. Radha Madam is also Dr. Ravi Raj Garu's wife, who is an OB/GYN professor and a doctor, well known, and who has done many conferences there, is actually the real person that has been doing so much work there. And so we have a great team there. Many other people are helping them. The local medical college, Andhra Medical College team there. And we have an event organizer called Meeti Events. Mr. Tirupati is helping us. From here, Dr. Prasad Chalasani, the cardiologist from Orlando area, is tremendously helpful to me and our team putting together everything in place. He's an Andhra Medical College alumni. He's a well-known cardiologist who does a lot of structural heart disease work. And he's a great person. He's been very generous with his time and resources and connections to provide all these opportunities for all of us to come together and execute a plan. He's on the phone in the middle of the night, 12 o'clock, 1 o'clock from here to back to India to arrange for these things. So we are seeking financial support from our friends and our well-wishers and our members, and they're all coming forward. And we invite all of you, the local population, to come and visit us at the Global Healthcare Summit in Visakhapatnam at Novotel from January 6th to 8th. We're going to finish on 8th on the beachfront with a walkathon, focusing on mental health awareness and vaccination programs and wellness programs. So we have a lot of activities, a lot of education, a lot of community engagement, advocacy. Everything is going on very well. And then, of course, all our local team here, Dr. Sudhakar Jonalgada, past president, who is also from Visakhapatnam, his wife, Dr. Uma Jonalgada, who is also an alumni of Visakhapatnam. They're helping us a lot. Dr. Udaya Shivangi, our Women's Committee chair from here, is helping a lot. And Dr. Shampa Shivangi, Dr. Srini Gangasani, our CME chair, and many other people, many committee chairs have come forward. Our past president, Dr. Suresh Reddy, helped us and guiding us a little bit, and more as the need comes, because he has a lot of expertise and connections as well. So we're looking forward to all of these team members to join together, and my entire team, Dr. Anupama Gotimukula from past president, the current president-elect Dr. Anjana Samadar, current Vice President Dr. Satish Katula, and of course Dr. Meher Medavaram. She's a champion for HPV vaccination and prevention program. She's taken it as her personal cause because she's a primary care physician who deals with this every day. So she's doing that as her own project and program, connecting a lot of people. Dr. Murali Krishna in India helping on this program. And then we have other team members, many committee members, many board of trustees, many regional directors are also coming. Dr. Prabhakar Sharma is coming. Dr. Pawan Panchavati is coming. Dr. Krishna Kumar is coming. Dr. Amit Chakravarti is coming. These are all our committee members. So I'm very proud and very happy to have them all on my side and at the front of the stage with me to welcome and involve and engage with the people, the students, the postgraduates, the local doctors, local faculty, local professionals, and professors. We're really excited. And actually, I'm leaving tomorrow in preparation of all this right now.
Wonderful, 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 wonderful. From myself and Mana TV international audience, wishing you a very happy journey for such a wonderful and a noble cause. I'm having goosebumps here listening to the complete agenda, and with such a wonderful entourage. You have mentioned the names who are helping which includes you as the president of AAPI, and so many objectives we just now discussed.
I forgot to mention one most important person, Dr. Lokesh Idara. He's the champion for medical education reform. He's champion of HPV vaccination. He's champion of international resuscitation program for membership for Indian Resuscitation Council. He's going to be there. He's a tremendous force of nature. He's always coming up with some ideas. He guides us like he's our guiding star. He's a North Star for us. He's there with us. He's bringing a lot of local resource. He connects us with the medical students there on a regular basis. He talks to them on a daily basis, and he keeps us posted what's going on, how we can help them, and how they can help us. So, shout out to Dr. Lokesh Yadara for his tremendous work over the last few years, and he's continuing to work like a champion for us.
Wonderful, wonderful. My best wishes to all of you, and you as well. I like that word, North Star. I mean, that had a tinge of poetry there, and I'm seeing that happiness in you. You're traveling tomorrow for a great cause, and all the plans are laid out. And definitely from our side, from our channel, and myself, and all of our audience, we wish you all success for this summit, so that it can help millions of people across the globe. May a lot of productivity come out of this lovely event. So, thanks for giving this time and this quality time of yours. A day before your travel to India. Tell us.
Yeah, if I may, I also forgot to add the government of India External Affairs Ministry invited me to participate in Pravasi Bharat Divas Day as a panel speaker on infrastructure of healthcare and the diaspora's contribution. I was invited on behalf of AAPI. I'm going there, and AAPI members are coming there to Indore for Pravasi Bharat Divas. It's a very tremendous honor to AAPI, and I'm so proud to represent. And we are well recognized. We're planning to interact with health ministers from the central government and various other dignitaries there and present our views and our plans and our vision. I've been interacting with the consul generals from this country to take the message back there to help us formulate some actionable, impactful plans to improve healthcare and make our motherland one of the best countries, if not the best country in the world by 2047, which is our goal.
Keep fingers crossed. A beautiful initiative again, a beautiful vision going forward. My best wishes as well, and hearty congratulations, for becoming the one to get addressed at Government of India. And I know that you'll go there with the light in you and spread it across with the entourage you have. Tell us in totality again the vision for AAPI and moving forward. Tell us and give us your excitement. Going to motherland and performing such a feat of sorts.
Yeah, AAPI is a tremendous powerhouse of very many capacities, including intellectual capacity, financial capacities, as well as technical capacities, as well as humanitarian skills and all those things. We want to bring all this to the action to produce some tangible results for our population in India, which we do great here, which we want to continue to replicate that in India as well, in whichever capacity. Of course, India has tremendous talent, tremendous resources. India is a tremendous infrastructure being built up. We are the world supplier of vaccines. We're a world supplier of pharma products. We're also going to become world supplier of medical devices. So we want to be there along with all the local talent to help build the bridges and continue to improve the brand of made in India, or Indian made products, Indian trained doctors to be the best and the brightest of the world. So everybody looks up to us, and we can deliver the goods for the entire globe.
Wonderful, wonderful, wonderful. And definitely, this is a very heartfelt and a pure, authentic cause. So I'm very sure it will come to fruition. Exponential growth will be there for the vision that you have put forward across the globe. And thank you so much, for giving such valuable information, and my best wishes, as I said, from myself and Mana TV International audience for the Global Healthcare Summit in Visakhapatnam in 2023. I know you guys will rock, and almost at the end of the show, and time just flew. It was such a lovely discussion with you, Dr. Ravi. Do you want to give your message to our Mana TV International audience and the larger NRI community?
Yeah, I want to wish all the audience of Mana TV as well as the entire population of our diaspora community and global population happy holidays, seasonal greetings, and a happy new year coming forward next year. And I want to thank Mana TV International Management and especially you, Sharad, for giving me this opportunity to interact and explain and express my feeling and connect with our audience again. I'm looking forward to coming back and talk more and more when we finish our Global Health Summit. We'll come back and we'll be planning for our next event, the National Annual Convention. We'll be planning on that from now, January onwards. We'll keep in touch and stay well, stay safe, Happy New Year, and prosperous and healthy New Year as well. Thank you.
Thank you so much, Dr. Ravi, for such a heartwarming and a wonderful holiday message, and your heartfelt message for New Year to our Mana TV International audience and the larger NRI community. Our best wishes for Global Healthcare Summit at Visakhapatnam. And friends, so it was a great discussion, and that was Dr. Ravi Kolli, President of AAPI, American Association of Physicians of Indian Origin, who gave a wonderful roadmap and a vision for AAPI 2022, 2023, and counting many years of prosperity and wonderful health across the globe. And we wish AAPI a grand success for the Global Healthcare Summit. And you have our Mana TV International audience support as well. So, the link is flashing on the screen to find out more details about.
Our website is for registration in India is ghs2023.com. And if you want to register in this country, any physician, summit.apusa.org. You can register both places. Thank you.
Thank you so much. And so, friends, stay tuned for more updates about AAPI and many other programs on Mana TV International. Don't forget to subscribe to our YouTube channel, Mana TV, and like our Facebook page, Mana TV, and keep watching our shows, and especially this show, and take notes. And if you're anywhere in Visakhapatnam, show up there. Go to the website, all positive vibes across about health. Best wishes to AAPI again. And thank you so much. This is your host, Sharad. Thank you so much.